Hari Om, Hari Om, Namaste. Thanks so much for coming here today. And we hope that you learn from this talk. And I hope it helps you to better understand Ayurveda. Because Ayurveda is a very sophisticated science. It's a healthcare system that was developed thousands and thousands of years ago. And it took thousands and thousands of years to accumulate the knowledge. It's fundamentally an herbal system based on using herbs and other treatments. And it's more advanced than I think people are aware of. So I want to talk about first the anatomy of Ayurveda in a quick sense, in comparing it to Western anatomy, because I think that's important, because we have our Western thinking, and then we're trying to look at a system like Ayurveda with this Western view of anatomy, and it doesn't work. So you have to change your thinking a little bit to better understand Ayurveda. So I want to talk about that first. And then second, I want to talk about the main phases of treatment in Ayurvedic treatment, because I think sometimes we're always looking for, what herb do I take for high blood pressure? What food can I drink to lose weight? Or what can I eat to help my inflammation? Oh, thank you, please. So we're going to understand, and I'm going to talk about the whole treatment process in Ayurveda, so you have a better understanding of what it really covers. It's more than just taking an herb for a condition or getting an oil massage. And third, we'll talk about panchakarma, which is a type of treatment in Ayurveda, but we're going to talk about what we call the real panchakarma. And then also I want to cover, right now, help you understand your actual, what people call body type. Are you familiar with Vata Pitta Kapha? Mm-hmm. A little bit? Do you know your body type? Who knows?
Yeah, I think so.
You think so? Who knows what their dosha or body type is?
I think I'm Pitta.
You think you're Pitta?
I think so.
Do you know?
I have
No idea?
Vata Pitta.
Vata Pitta? They told you that? Okay, good. So let's talk about that first, because this is really the most important area to understand in understanding yourself, because knowing your body type, and the actual name is Prakriti. Prakriti means your original type that you were upon birth. And it's upon conception. But we're really only concerned about from birth on, that type. That's your Prakriti, what you were born as. So first thing you need to understand is that there's really no such thing as body type in Ayurveda. You're not Vata, not Pitta, not Kapha. This is a false kind of or misunderstanding. So that's the name of the talk, understanding these misconceptions of Ayurveda. And that's probably the biggest one, that my body type is Vata, Pitta, or Kapha. There's no such thing. Between Ayurvedic doctors, there's no term like this. We're talking about the person's original type, the Prakriti, what they were born as, and then it's called Prakriti. So a better question would be, do you know your Prakriti? That's the original type that you were at birth, and you should be now. And then there's your vikrti, and that's your imbalance. So if I'm going to communicate about your health to another Ayurvedic practitioner, or even my own notes, or the first thing that any Ayurvedic doctor wants to understand when he meets a new patient is, what is the person's Prakriti and vikrti? Not body type. There's no such thing. It's Prakriti and vikrti. And that's why when people do online tests, they get mixed results, they get confused, and then when they go see an Ayurvedic doctor, he tells them something different. It's because when you're taking the test, you're probably thinking of yourself now. And that's not your Prakriti, that's your vikrti. Vikrti is your imbalance, even your disease. The best example is this. Say your whole life, or after puberty, we'll say, you were a thin person. You were thin, you were never put on weight, you were dry, you had a little anxiety, nervous. You had all the signs of a Vata person. You had cold hands and feet, so you had a dominant Vata dosha. And you were like that your whole life. Skin, dry, cold, nervous person. Okay, we all know some of these type of people, right? So they don't sleep too well, they get a little constipated and things like that. So that was a person's Prakriti. And it's only dominant. There's still Pitta in that person, there's still Kapha in that person, but mostly they're Vata. If the vata gets too high in that person, then she could have nervousness, anxiety, insomnia, degenerative bone conditions, be depleted, and have even anemia. All those are types of depletion or high vata state. But let's just assume she was a healthy, skinny, nervous, dry person. So she was vata dominant. Now, later in life, a couple kids, a couple divorces, a few foreclosures, things happen in life. And she had a little stress, ate a little too much, got a little clogged up, maybe had a period of, partying, drinking, how it all goes. So now at 50, maybe this person is no longer skinny. They're big. And maybe no longer their skin is even dry. Maybe it's oily. Oh, and maybe they're not nervous anymore. Maybe they're lethargic and fatigued. So in that case, the person's prakriti, original body type, was vata. Maybe vata pitta, maybe vata kapha. We'll talk about that, variations in a minute. But now their vikrti, their imbalance, is kapha. Because they've put on the weight. They've got clogged up. The systems are clogged. The body is clogged. Maybe the colon is clogged. The lymph is clogged. It's blocked. Maybe there's ama or toxins built up in the whole system, and the tongue is white. And either snoring, having trouble breathing, the whole respiratory could be all clogged. So now they've got, because of toxic or ama accumulation over time, they've now become all clogged up, and now they've put on weight, and they no longer look like a skinny, dry, cold woman anymore. They still could be dry, still could be cold, but they're not vata anymore. They now have a kapha vikrti. So, if in my notes, or an Ayurvedic doctor would say, vata prakriti, vata prakriti, yeah, and kapha vikrti. So, two totally different assessments. And that's the proper way. So, in Ayurveda, you're only taking the person back to their original body type, or prakriti. So, if you were say we'll do it the opposite way. Say you were a big woman your whole life. You always had to watch your weight. You had nice shape to you, big shape, even when you were young. So and maybe you were a little oily skin, and you're a little slow to get going in the morning, didn't have much appetite. All the signs of kapha. So maybe you realize, okay, my original body type, or prakriti, is kapha. But maybe you got sick. Maybe you damaged your liver. Maybe you fasted too much. You skipped meals too much. You ruined your digestion. Maybe you were bedridden for a while and you became thin. Or maybe you became more vata and depleted. Maybe trying to fast so much to lose weight, you actually depleted yourself and you went the other direction and became nervous, anxious, lightheaded, dried up, and weak. You became too vata. Maybe you had an infection or herpes or an intestinal or liver, a virus, and you had inflammation and pain, and maybe you went through menopause and you got hot and sweaty, so now you became pitta. So maybe you could have been a skinny, cold person before, but because of menopause, you're becoming hot and sweaty and irritable. That's pitta. So you could have been a skinny, cold woman, but now you're a hot, angry woman. So your vikrti became pitta. You have pitta problems. So when you have pain, inflammation, heat, burning, those are all pitta problems. Maybe you weren't born that way. So your original body type, or prakriti, could have been vata or kapha or vata kapha, kapha vata. But now you have this inflammation, pain, hot flashes, heat, burning, joint pain. So now you have a big pitta problems. So we want to address these pitta problems to reduce the pain and the inflammation down. So you have to understand there's the prakriti and the vikrti. You have to know both of yourself. So the easiest is if you take a test, you want to write down, check off all the little boxes, what you were most of your life. What you were like, from puberty, before all the kids and all the trauma and things in life, and in your 20s. That was probably your prakriti right there. Unless you had some early childhood illness or trauma that would have affected you early on in life. which also can happen. But generally, the children, their prakrti and vikrti is the same. They haven't gone off and found the imbalance. Vikrti kind of means imbalance. It can almost mean the disease, the aspect of you that is out of balance. So that once you know what you were originally, then you have to assess what you are now. So then, of course, you have to decide which of these doshic imbalance are you going to address first. But that's another subject. But second point I want to make is that we're not just vata, we're not just pitta, we're not just kapha. We're often combinations. So you think, well, I'm kind of skinny, I'm kind of dry, but I'm not really thin, and I'm not weak, and I don't have a weak digestion like vata. I'm a little more muscular, and I'm not that cold. So more than likely, your more original body type was a vata pitta. So you're more of a vata pitta type of person. And if you put on, you have a lot of vata qualities to you, but you were never a skinny little nervous woman. You kind of had a little bit more shape to you, a little bit more relaxed than your skinny nervous friend. So maybe you were more of a vata kapha. So your prakrti could be kapha pitta, kapha vata, vata pitta. Could be any combination. It could even be tridoshic, where all three are relatively balanced. Then you're very lucky. Your vata, your pitta, and your kapha are nice. So Ayurvedic doctor, they feel each other's pulse, and the nice compliment is, oh, you're a vata, very nice. Oh, no, it's good. Your pitta, oh, pitta's good too. Oh, yeah, you have kapha, it's nice. So they're assessing your vata and pitta, and then they like to find the patient and the people who have all three in balance. Because Ayurveda is about balance. Because if you maintain the balance, you don't have the major imbalance, which leads to disease and serious problems in the systems and the tissue of your body. So those are the first 2 points I want to make. First, you have to know your original body type, prakrti, and you have to know your vikrti, what you are now. And then you should look at these in terms of maybe being vata kapha or pitta kapha or little combinations. So that's why it's really better to have somebody assess you for treatment purposes. And then, of course, for treatment, well, would you give a person was vata prakrti, but now they have a kapha imbalance, vikrti? What food are you going to give them? You have to give the food still often based on the original body type, because the digestive system more than likely didn't change. But the herbs that you give the person will focus mostly on the vikrti, the problems. But at the same time, since we have a vata person who now has this kapha imbalance, blockage, weight gain, lethargic, fatigue, but she's still having gas and bloating like a vata, well, maybe we can give her a diet would be like kapha vata diet. It's kind of kapha because we don't want to give her a lot of dairy and clog her up and put weight on her, because we can't just give her a vata diet because that's going to encourage weight gain. Because if we give somebody a vata diet, we're basically assuming this is a skinny, cold, dry, weak person and needs a lot of dairy and even bone broth and 4 meals a day. But our vata person is no longer skinny little, well, she became too kapha. So we have to take in consideration her digestive system, which is still sensitive like a vata, but the fact that the body is no longer vata. So maybe we give her a diet, kapha vata diet. The kapha will bring down the weight-gaining foods like the wheat and the dairy and yogurt, and focus more on weight loss foods to some degree, and improving circulation and getting things moving again. But at the same time, taking consideration that the person has a vata digestive system, which tends to be easy to get gas and bloating and constipation. So the diet could be kapha vata. And after the person feeling better, losing weight, circulation's better, lymph gets going, the colon's cleaned out, bowels are moving, liver's functioning better, and they're feeling better, then when they closer to back to where they were before, they can go over to maybe a vata kapha diet. So the diet could change. And even times of the year, in the summertime, we all can get more pitta, more warm, more hot, and that has to be a consideration too in giving out a diet, is the weather. Obviously in the winter when it's cold and dry, you're going to become more cold and dry, and we don't want to aggravate that. And in the summer, you're going to become hot and warm. So the diet should go with the season as well. So there's these considerations. So those are the three main considerations that we have when giving a diet: is your original body type, the state of your digestion, your current imbalances, and even the season. And of course, any health conditions in there as well. If you had diabetes, you had high blood pressure, you had inflammation and pain, this would also make some adjustments to your diet accordingly. So the diet is perfect for you. And I hope you know that in Ayurveda, nobody has the same diet that everybody eats. Food is given out differently to each individual, particularly when it's therapeutic. If you're healthy and balanced, your vata's nice, your pitta's nice, your kapha's nice, and you can eat with the seasons and eat with the harvest and be more balanced, and all of your foods can be balanced. But if you have a vikrti imbalance, like high kapha, clogged up, high pitta, inflamed, high vata, where you're depleted, then you're going to want to follow a more therapeutic diet that helps balance that out. So I hope that helped you understand a little better. Yes. Help you. Now you see more clearly there why you got confused online, trying to figure that out. Yeah. So you can't jump to conclusions too quickly. I'm vata, I'm pitta, I'm kapha, because you could, and then go pick one diet. I'm a vata diet, pitta diet, kapha diet. It's a little more sophisticated than that. Young people can. If you're young, in your 20s, you don't have big health problems, and you took the test and you're clearly vata, and you look at the vata diet and it clearly matches you, then you're probably okay. But as we have more health problems, you have to be more careful in taking that type of self-care approach to Ayurveda. So I like to clarify that, because this class is really the introductory class to a series of classes. I gave you the flyer there that I'll do until I have to travel. And then again in the summer we'll do more of them. So this is kind of an introduction, because I don't want people to come and think, what's my body type? I want people to learn Ayurveda properly. And this is the first thing I hope that you can understand for these series. So at least we're using the same terms. So now if you ask me, you won't ask me what's my body type. You'll at least ask me, what do you think my prakriti and vikrti is? And then at least I'm happy with the question. Okay, it doesn't make me like, cringe, So that's just my own motive here, to kind of prepare you for the rest of this course. So the next area I'd like to cover is understanding the three phases of treatment in Ayurveda. And this is also very important, because we tend to be looking for quick fixes. We tend to always be looking for what herb do I take for high blood pressure? I got a headache, what herb do I take? So there's really no such thing, because in Ayurveda, a vata prakriti type person could be asking, what do I take for my headache? And a pitta type person could be asking, what do I take for my headache? And a kapha type person will take. So these people are completely different. We have a skinny, cold, dry person. We have a warm, hot, inflamed person. We have an overweight person. And even the types of headaches could be different. Could be a sharp headache, could be a dull headache that lasts all day, could be a headache as a result of so many different things. There's so many causes. So in Ayurveda, you have to know the cause. And headache is probably the most challenging, because there's the most amount of causes. You could have just not be eating on time. You could just have a little anxiety in your life. You could just have poor circulation. You could have hormonal imbalances. There's just so many reasons for your headache that nobody could answer this question without just guessing. Now, it's true, I do have a tea called headache tea with white willow bark, which is what they made aspirin from, and feverfew, and meadowsweet. So it's a very nice tea to kind of take care of acute headaches. You have the headache, you drink the tea, it's like an aspirin. But you didn't really cure it, because you didn't think about what is the cause. Nobody talked about the cause. And I find a lot of people here don't even care about the cause. They just give me the tea for the headache. But that's not Ayurveda. That's an allopathic approach. When you say, I have joint pain, what do I take? That's an allopathic approach. In Ayurveda, we have to know the cause. A few things we have to know. What's causing this pain? And two, and that could be, and that's knowing the whole pathology of how it developed over time, which is a big subject, and also the prakrti and vikrti of the person. So if I know your prakrti is vata, and I know your vikrti is pitta vata, maybe because you have a lot of pain and inflammation and you're hot, so the vikrti is pitta. It's the pain. Pain is pitta. And you are a pitta person or a vata person, that's given me information I need to choose the right herbs for your type of headache. And in Ayurveda, and your type of pain, we should say. We could use pain as pain's a good example because people always are coming to me, what do I take for my pain? And it's really, what do I personally need for my type of pain would be for my prakrti and vikrti, and my type of pain, what would you suggest? It'd be a better question. Because, and that's why I can't answer your question about your mother, or your grandma, or your daughter. You know, people always ask me in a group, and there's 100 people there or whatever, and they say, oh, my dad has diabetes, what can I give him? Well, unless dad's here, and I can at least see him and have some clues, there's no way anybody could accurately answer that question. It would just be guessing. And of course, most of what we see online is Facebook type of health tips. They're just guessing. And not to say that it couldn't work, but it's a guess, it's a shot, even for weight loss. But back to pain, we could say there's 3 main types of pain. There's actually 5 in Ayurveda, but one is a type of dry pain, a kind of a cracking joint pain. More of a kind of, you could call it osteoarthritis or degenerative bone condition, but it hurts when it moves. This is a vata type. It's dry, it's not really hot, and it hurts more when you walk or you move or you're moving your hands, and feels better when you're not moving, and feels better when you're warm or like in a hot bath. Salt bath feels better. So this is type of a degenerative condition in the bones, where the cartilage is worn out, the bones are grinding, it's hurting. This is a vata type of pain. Now the pitta type of pain is more hot and inflammatory. You touch it and it feels hot. And in fact, taking hot bath will make it feel worse. Cold packs, ice packs will make it feel better because it's really inflamed, it's hot. You can feel it to the touch that it's very inflamed. And then the third type, just to reference the 3 doshas, to give you an example, is the kapha type, where it's more swollen. There's a lot of weight gain, the body's swollen, there's edema, there's blockage in the circulatory system, and the knees, the ankles, they're swollen and blocked, and they're painful. And they actually feel better when the person walks and gets moving and gets things going. So you have 3 types of pain, but of course you could just call it arthritic pain and take an aspirin for it, or painkiller. But you're not understanding or addressing the cause. And in Ayurveda, we have to know that cause, what caused it. And of course, this is a whole nother subject, but we have to know what type of pain. So if it's a vata type of pain, well, obviously we're going to give warming herbs, herbs that are building, even giving dairy, even butter. So many women have come to me, or men too, with this type of degenerating arthritic pain. Osteopenia, osteoarthritis, where the bones have depleted and the cartilage is lacking, and it's rubbing and hurting and painful. And the medicine is butter. That's right, butter. Because butter will build tissue, build more fat, and lubricate the joints. Within 2 weeks of taking butter, most people, they can't do cracking anymore. There's just no more cracking in the hips, no more cracking on the neck. It's all gone. And the pain also is reduced. So the herbs are taken in butter. And butter is encouraged and dairy is encouraged because that's her type of pain is degenerative. So we're nurturing the person, giving them butter, giving them fat, giving them oil, even oil massages, and lubricating the body, lubricating the joints, and putting on weight, putting on fat to protect these bones. And it doesn't take very long to put on weight, fat, eating butter. So it's a very good, nice results. And there's specific herbs with it. But what about the person who has inflammatory pain? They have inflammation, maybe heartburn, maybe burning, maybe acidity, and they're getting hot. Well, these are more anti-inflammatory herbs, bringing down the heat, bringing down the hot body temperature, and even taking away these inflammatory foods like nightshades, tomatoes, eggplant. I don't know how many hundreds of people have come to me with this type of inflammatory joint pain and are eating tomato sauce every day. And once I take care of the tomato sauce, the eggplant, the nightshades, the paprika, the bell peppers, even some spicy food, they always say, I think even before I took your herbs, just getting rid of the tomatoes every day that I was eating the tomato sauce, because my wife's Italian, I think that helped even 50%. So there the person was having the inflammatory foods every day that weren't suitable for their own prakrti. And once you remove the foods, half the problem's gone, because that was part of the cause. Just like the woman or person earlier who had the degenerative bone condition, part of that cause was maybe the low-fat diet. She was maybe scared of having butter. Maybe she read something on Facebook or something. You know, people get confused reading Facebook, because you can't get information from a book about your own health, because the book doesn't know you. You can't get information about your own health from Facebook, because Facebook doesn't know who you are. Somebody has to look at you, see who you are, and then choose. Because if you have even joint pain, I have a lot of choices. And if the kapha type of pain where it's swelling, we want to get rid of the swelling, get rid of the edema, get circulation going, and the herbs and the treatment are entirely different. But to everybody, that's just pain, joint pain. But to Ayurveda, it's not. It's what type of pain and what is the cause? Because most people are doing the cause every single day. Every day. People pay me to sit and tell them to stop drinking coffee so they can sleep better. I have people that I have to put back on dairy because they're weak and their bones are cracking and their joints are cracking. So I put them back on dairy. I have people that I'm taking off of dairy because they're all clogged up and their fatty liver is clogged, but they've been, frying steaks and having lamb chops for 20 years. And, but it's maybe organic. Now they're down to organic burgers. But that high-fat diet is what, and particularly this high-saturated diet, has been affecting their liver. Even people doing too much coconut oil. They're taking coconut oil in the winter when it's solid and their body's cold, their liver's clogged up, their circulation's poor, and they're just taking coconut oil every day because they read it somewhere online. So coconut oil is a cooling oil. You don't want to take it in the wintertime. And you don't want to take it if you have congestion and blockage and fatty liver and even excess weight, despite what you read. Because the Western world only looks at things from a nutritional point of view. And this is a flaw. Maybe we don't use the word flaw. Maybe we say it's a very limited understanding. Like I have some herbs that are brought in from India and they're required to write out all their nutritional content. And you see a little vitamin C in there and that's it. But here's this powerful herb that can do so many things, but when you break it down nutritionally, all it shows is some vitamin C and a little antioxidants. So it's a perfect example to show you that looking at food and herbs just through the nutritional point of view is very, very limited. So choosing your foods based on what has a certain nutrient that you're looking for could be a big mistake. Well, people with pitta prakrti who has hot, acidity, high blood pressure, joint pain, well, sometimes they're having tomatoes every day because they read that they're high in antioxidants. But it's making their condition worse. So I always say that there's really no such thing as something being good or bad. And I do a lot of speaking and a lot of seminars, and people always ask me at the end, is coffee good? Is dairy good? Is wheat good? Is chocolate good? I mean, it's like everywhere I go, they ask the same questions. And I will give everybody the same answer. So this guy stop you from asking this question. And that is, the answer is to all of these questions is, it depends. Even coffee. If you're a nervous, anxious person who can't sleep at night, is coffee good for you? No? Well, it doesn't need to be an Ayurvedic doctor to know that. You can apply some common sense. But you can do it the other way too. What happens if you're a slow, lethargic person who sleeps late in the day, never had any anxiety in their whole life, and wake up and coffee be good for you? Yeah, for you, coffee can be medicine. What about butter? You have a clogged up liver, you have a clogged up system and you have high cholesterol and fatty liver, then, obviously eating butter. But if you had a degenerative and you had dry stools and dry skin and weak bones and cracking nails and hair falling out, you could use some more dairy. Will help support the growth of your bones and your hair and help you in many ways. So butter is often used as medicine if used properly. And even wheat. Most people nowadays are scared of wheat. Of course, in the 70s, when I was young and giving out herbs and things in my youth, making whole wheat bread was the mark of a health food person, if you remember those times. So I used to make this whole wheat bread and knead the bread, and I would give it to people, and they said, "Oh, wow, you're like a health nut. I mean, look at that." I mean, they were still eating rainbow bread back then. So that was the sign of good eating back then, was to make whole wheat bread and to have brown rice. But now, it got some bad rap, to help them out, I think. But, most of the problems people have with wheat aren't really the wheat, and the same for dairy. It's just their digestion. Mostly they just have weak digestion. Like my son said, if you can't eat a piece of, you don't have the capacity to eat a piece, you don't have any digestive capacity. And look at kids, they're eating bread, they're eating dairy, they're not having any problems. It's only us adults who get clogged up, have bad eating habits, been snacking all day, eating nuts, eating pizzas late at night, don't have much appetite. We got ourselves clogged up, our liver's blocked up, our colon's blocked up, and we're having lymphatic problems, and we're eating at irregular times, eating foods that aren't compatible with us, eating processed foods, and we've been doing this for 30, 40 years. Maybe we've had other things on top of that too, drugs and alcohol, further complicate the situation. So now you could have big problems digesting wheat. And your whole immune system could be aggravated. So now you're going to start reacting to all types of things and start having all types of food allergies. But food allergies are still back to your poor digestion. Because if your digestion's good, you could be eating food even with pathogens in it and bad bacteria and viruses, and you still would be able to get rid of it. Like in India, a lot of people get sick, but probably the food is not that clean. But when you have but at the same time, you should be eating bread. So that's kind of a separate subject question at the end of and the person's original body, and to balance the person's dosha or vikrti, to reduce that extreme imbalance back down to something more manageable. In Ayurveda, we say we don't want the dosha to be too excited. We don't want the vata to be so high they're nervous wrecks and can't sleep. We don't want the kapha to be so high that they're just lethargic and have no appetite and are sleeping in the day. We don't want the pitta to be heartburn, acid reflux, irritability, and pain. We have to calm these extreme imbalances down and try to balance out the vikrti and prakriti. That's usually the first step. Second is to improve the digestion. Because it doesn't matter what herbs you take or what vitamins you take or what food you take, if you're not able to digest it, assimilate it, and properly eliminate it, then it's all going to be in vain. And this is a big problem we have here because we focus too much on the food and we don't focus on digestion. That's why people couldn't digest vitamins, so they made liquid vitamins. People couldn't digest wheat, so they would go gluten-free. People couldn't digest dairy, so they go dairy-free. But nobody talks about fixing the original problem. So Ayurveda always starts with help you feel better, help you to get more. So that can just mean, cooking your food more to make it easier to digest. They don't like hard, raw, difficult to digest age where their digestion isn't yet. So that's another kind of flaw that we picked up in Western nutritional science, that uncooked foods are healthier. Well, that type of scientific, if I do say left brain type of mentality, where you're not really looking at it, when I look at it in my lab, uncooked, then cooked, then it must be better. I think limited view, and that's nutrition. And too many of your problems, unless it's purely a nutritional deficiency. But mostly that's coming, if it's not digestion. Most cases it would be your poor digestion. So balancing the dosha or before meals and digestive aids after meal, and changing the diet. are usually the first steps. And that's usually the first appointment with a person. Doesn't matter if you had pancreatitis or high blood pressure or cholesterol or a growth or a cyst or tumor. Still going to fix your digestion first. There's no, okay, here's the herb for your tumor. Fix the digestion first. Balance out the doshas. Get the basic fundamentals working, the digestion, the simulation, the sleep, and these type of essential aspects of human functioning here, of the human body, so it itself can help in healing. Because if it's not sleeping, not resting, or not having good healthy digestion, good assimilation, and good elimination, then there's no point to move forward. Sometimes I even have to do 1 or 2 appointments with a person before I can move on to the next stage. So the next stage is usually the actual treatments, where you're focusing on the system in the body. Like for blood pressure, it would be the cardiovascular system, or in Ayurveda we call it Rakta Vayusotra, the blood circulating system. And they're all, because it's a tridoshic theory, there's Vata, Pitta, and Kapha. We treat the system that's involved. And then third, we give some treatment for the particular condition of the organ, low blood pressure. And these treatments are mostly herbal. It's an herbal system. Once you have a serious chronic health problem and you've maybe even on medication or doctor suggesting medication, it's going to be hard to dig yourself out a little weight, or you're losing hair, or you're starting to get a little imbalance when you're in your 20s. You probably could adjust your diet and save you a long time. So now this has damaged your kidneys, damaged your liver, and you've really done nothing to really cleanse out the body or balance it out. You've just been pacifying it for years with medication. You're probably not going to be able to get out of this to eat fast or juice or raw, these type of things. All you want, much success. Herbs are used to treat the liver, to treat the kidneys, to treat the heart. The joints, they actually get right into the joints and clean out the accumulation. It's uric acid building up, like in the case of gout. So these herbs get right in there and reduce the uric acid, improve the kidney function that's, of course, contributing to the high uric acid levels, and remove it from the body. So if you took the herbs for 3 months, then not only does gout is visibly gone, but the pain's gone and it's not coming back. So the treatments aren't to pacify or subdue the symptoms, but to remove the cause and to support the organ and support the system. So that's the second step, is the actual treatment, is to depending on your condition. So the last stage is to rebuild. We could also call it like a type of nutritional therapy, because Ayurveda does nutrition, we could call it, last, not first. First is balancing the body, improving digestion, treating the condition, removing the causes. And then last is to rebuild the body and to support it, we could say, nutritionally. Those are the 3 stages. Often, even my own patients, they forget the last stage. They don't come back. First I fix their digestion. Then I balance them out. Then I treat the what they came for, the pain, the inflammation, the excess weight, the depletion, the thyroid dysfunction, the reproductive imbalance or fertility or whatever it is. And then they're happy, so they don't come to the 3rd stage. And the 3rd stage was also important. Support the reproductive system. I wanted to support the heart. I wanted to support the circulation. And maybe I wanted to change the whole diet, because now they're not the same person they were when they came to me 6 months ago. So I have a problem with people not coming for this follow-up, this 3rd stage, this rasyana, the building stage, which is to make sure that the body is supported, or that organ and that system is supported, so the problem doesn't reoccur. But people are generally so happy that their pain is gone, they've lost their weight, or their hair stopped falling out, or their pancreas is working better, their liver is working better, the doctor says they don't need to take cholesterol medicine, or they're able to get off of their high blood pressure medicine and their blood pressure's down. Usually they're fine with that. Maybe they keep ordering the tea for blood pressure, or just keep taking some relaxing teas. They often don't do that 3rd step, and then all treatments are based on these 3 stages. So The second stage is the treatment stage, and within that, the Ayurvedic doctor has the choice of giving type of panchakarma, which is our next subject. And panchakarma is often misunderstood here in the West, and even in India, it's not practiced right. If you go to any type of tourist place or resort place, they'll say they do Ayurvedic massage or maybe even panchakarma, and it's very hard actually to find true panchakarma even in India. If you're particularly around a tourist type of place. But even the Indians have become accustomed to the similar flaws in our thinking, like what herb do I take for my back pain? Or thinking that just oil massage is loosening up the toxins and preparing. Usually there's a khichdi done here, and then the oil massage, sneha, which means oiling the body, and sveda, which is, if you go to Panchakarma Center, they just give you oil massage and then put you in a steam box. It's called Purvakarma, before Panchakarma. In India, they may say they have Panchakarma, and they're just, maybe there's no preparation at all. They're just giving you oil massage in the steam box and oil massage in the steam box. Well, that's not Panchakarma. Pancha means the 5 types of treatments in Panchakarma. Not all, in fact, if a true Panchakarma, first they would do the Purvakarma, which is the khichdi diet and the certain type of diet you would do maybe up to a week, taking a lot of ghee and oilating the toxins, getting things moving, getting circulation going, lubricating the body. Things will start moving, the bowels will start moving, circulation will start moving, but you haven't got it out. You haven't treated the condition. You've only prepared to. So that's why if you just stop at that point, you may feel good getting all those nice warm massages, but you didn't get in there and you didn't do the treatments, the karmas, the actions. And there's 5 main actions in that can be used. And the first one is a basti, or enemas. So if you had a panchakarma, if you say, oh, I had panchakarma, but you didn't have an enema, nobody stuck a little hose on your butt and poured in some water and some herbs and some oil, then you really didn't do panchakarma. You did purvakarma. You were our oil massage. And if you didn't do the steam, then you really didn't do anything, because purvakarma is always with the oil massage and the steam, rotating back and forth. And different types of oils. They're not just using sesame oil. I was recently in India, and it was at some resort place, and they said they did abhyanga, or the Ayurveda massage. And I asked him, what oils would you use for me? Because that would be the proper question. If I say, what oil do you use? He could have 100 oils. So the right question to ask him is, what oils would you use for me? So now he should do a quick diagnosis to figure out what I am, just even by looking, or asking a couple questions, or feeling my pulse. And then he should be able to tell me what oil. So it was hot, and I was red, and I'm a type of Pitta Kapha Prakriti. So, I'm on the Pitta side. I can get warm, I can get red, I can get little rashes and things like that. So, and it's very hot where I was at the time in Goa. And so the person should have said, for you, we use coconut oil. It's hot outside, it's sunny, you're a kind of a Pitta guy, we should use coconut oil. That would have been the correct answer. But no, their answer was, whatever you want. See, so now we know there's no training there, no knowledge, nothing. You're just giving a massage. And they were using sesame oil. I said, why are you using sesame oil in the summertime? Well, they said, that's what Ayurveda mostly uses, sesame oil. Yeah, but it's not for a pitta. Sesame oil is warming. In other places I've gone, they're doing we use coconut oil, we got organic coconut oil. Well, if you have a thin, cold, dry person with cold hands and feet, even in the summer, that coconut oil is going to make it worse. So, the oil has to be chosen properly for the person. And they don't really just use oil or sunflower oil. Often they're mixing the two together, like half sesame, half sunflower. And these are herbal oils. They're putting herbs in these oils to have a greater effect. So they're really herbal oils. Not like in the resorts, they may just be using only coconut oil, just sesame oil, and giving you a massage, and then calling it panchakarma. So it's not even really true purvakarma, because nobody adjusted it to you. So either oil should be adjusted, and then the steam, the sveda, where you get in the steam box. Have you ever done that? You do that? So that's you do the oil, and then you get in the steam box. Now, if you're trying to break up the lymphatic system and get things moving in the steam box, you need like camphor oil, eucalyptus oil is in the steam. They put essential oils in the steam, and that gets things moving. I mean, the nose starts running, the eyes are tearing, the body's sweating, and it really gets things moving if you steam yourself with eucalyptus oil. If you've ever even just been in the shower and just sprinkle some on the in the shower, just rub it here. It's just, clears you right up. So if you're a kapha and you have blockage, or sangha we call it, where the systems are blocked, then eucalyptus oil would be perfect. But not if you're a hot person with inflammation and joint pain. It's only going to make it worse. Then you would want to use cooling oils like rose oil, sandalwood oil. But no, if you go most places, even in India and here, even in the West, they may just use lavender or something because it's popular. Which would be nice for the vata who's nervous, stressed out, anxious. You could put a little lavender, relaxing essential oil in there. So the oil massage for the body is custom. The steam is also customized for the person in Purvakarma. And then back to the panchakarma, the first one is basti. And that's never using just water. There's no such thing as colon hydrotherapy in Ayurveda. They always are putting some oil, some herbs, some honey, some goat milk. I mean, there's a concoction that they're putting in there. It's therapeutic. In fact, this is why you're treating a lot of cases of irritable bowel. I mean, the problem's in the colon. How are you going to get to it? You make the herbs that are anti-inflammatory and healing, and even put aloe salts. I mean, how can be taking a pill or even taking an herb in your mouth going to affect your colon that sick if you just put it in the rectum, getting right to the problem? But these are all herbal treatments, mostly with support the system. Basti, the first type of panchakarma. And then vamana. Vamana is therapeutic vomiting. So if you have upper respiratory problems, congestive problems, or asthma, or breathing problems, or snoring, or clogged, it's a kapha. It's breaking up the whole front. We give you, there's a little preparation. Again, you got to do the purvakarma to loosen up the phlegm and loosen up the congestion, and 5 days of hot oil massages with mustard oil and steaming in a room with a box with eucalyptus oil. Believe me, you're loosened up. It's all loose, and your nose is running, phlegm's coming out, and then you take this herb that with some licorice and maybe some salt and drink it down, and you'll have a vomit in a bucket, and that will clear that whole upper part of yours. Vamana. This is part of panchakarma. So if somebody wasn't having you throw up, you weren't doing panchakarma. And then vrchana is you take a very strong herb at usually at night, and the next day you have a purge. Vrchana is like a purge. It's flushing the whole GI tract right from the duodenum, small intestines, all the way down, not just the colon. And it's just flushing it right out. It brings down heat, brings the energy back down, and helps liver, gallbladder, cleans it, flushes them right out. And these you have to know your herbs, because you want a person to have 4 or 5 loose bowel movements the next day. So every person that comes to you, you're giving them different herbs. And even a person has loose stools and is going all the time, you still have to choose your herbs very carefully compared to a person who has constipation and dry stool. So the herbs you're taking for that treatment are very important. In fact, I saw this Indian doctor, was a real master there. He was collecting all of his own herbs. He was 5th generation Indian doctor when I was just in India about a month ago. And I met this guy by chance. And every month he goes and gathers all the herbs from the jungle like they do down in Kerala with him and his 5 sons. And he makes all of his own products. In fact, I'm taking his herbs. I have the whole clinic full of herbs. I'm giving out herbs to my patients all day. And I'm taking herbs from some guy in India who gathered them in the jungle himself. And has like a little machine that just kind of pounds them into a little ball. His kids are rolling them up and making little balls. So I have this little bag of these balls that I'm taking before meals, after meals, at night. And when I was there, he gave me one. He said, okay, we're going to do vrchana. That's the flush, the purge. So he says, wake up at 4 in the morning and just take this little black ball. And I go, you sure you don't want me to take it at night? Because mostly I give to my patient at night, late at night, and then maybe they'll get up at 6 in the morning, rush to the toilet, and by 10 or 11, they're fine again, really cleared out. But he says, no, this is very strong. And I asked him, what's the name of it? I'd never heard of it. And I said, tell me more about this. And he says, well, it's a bean, and the bean is poisonous. And if you ate the whole bean, you could die. Child could die. So I said, okay, well, this little pill you're giving me here, I trust you, but how much of a bean's in one of these pills? He says, oh, one bean, we make 20 pills. So, one bean, you'll just have nice diarrhea, very nice. Oh, it's perfect, it's very quick, 2 hours, fantastic. Cleared you right out, you'll love it. But don't take it at night. Take it early in the morning, because it's that powerful. I couldn't believe it, because I'm giving people like 1 teaspoon, 2 teaspoons, at night, and they're going early in the morning. This guy's giving me a tiny little pill, tiny. And he says, take it at 4 in the morning, and by 2 hours you'll be going. Sure enough, I woke up at 4 in the morning, took the little pill, and I felt it coming, 5, 6 in the morning. And I was thinking, boy, God, it's a good thing I didn't have 20 of these little things. Now I know why. 20 would have killed you, because I could feel it. And 6, 7 in the morning, I was having the runs, and I was on the toilet for a couple hours. And by 8, 9 o'clock, I was feeling great and hungry. So by 10, I went to go see him again, and he says, oh, you look great. My belly dropped right down. I had a big old lunch. I was full of energy. I felt fantastic. That's Vrachana. That's a type of panchakarma. Purge the system. And then the nasa, putting the oils in the nose, also is part of panchakarma. It's to reach the brain. So people come to me with anxiety, Alzheimer's, and dementia, and certain problems. Here we're using the oils, and we're putting them right in the nose. And they go, why you put them in the nose? I said, well, if I give you the tea, you're just going to drink it and pee it out, which is great for your bladder and your kidneys and your urinary tract and your bloodstream. But I want to go right to the head. So I want you snorting this oil, herbal oil with herbs, right in your nose, and put it on your temples and put it on your head. And that goes right into the brain and affects them immediately. So nasa, putting the oils in the nose, is a type of one of the panchakarma. And the last one is called purvakarma, not purvakarma, rakta muksha. Rakta muksha is bloodletting. And this is where they put the leeches on your body, and the leech sucks out the blood. So if you have gangrene or something, they just put your whole foot in a bunch of leeches and suck it right out. It's very, very quick. Because a leech, apparently, he likes the toxins. So he goes right for sucking out the toxins out of your blood. For psoriasis, eczema, and serious skin conditions, they do it. But you can also do mukta raksha. You don't have to have the leeches. You can use teas and certain herbs. I have a blood detox teas, and even dandelion or burdock is helpful in cleansing out the blood. So you can still cleanse a person's blood out without using leeches. But the treatment is still a blood cleanse. So you're cleaning out the colon with the enemas, and we're not talking one. We're talking maybe like 5, 6, 7 of these things. We're talking vamana, clearing out the upper respiratory by throwing up once or twice. We're talking vrachana, which usually you'll have to do once, maybe twice. And then you're doing some type of blood cleansing, which if you're using leeches, maybe you have to do it a couple times. If you're using herbs, you may have to take these herbs for a month to clean your blood out. That's panchakarma, not oil massage. And then after you're done, there's a third stage, again, of rejuvenation, having like chawan prash and more rice and khichdi and rejuvenate the body. And there's all types of herbs like ashwagandha, vidarikandra, and things that will help to build up the body and strengthen the organs, because you did all of this cleansing, or panchakarma. So that's true panchakarma. Preparation, purvakarma, actual treatments, panchakarma, 5 actions, and you could only do 1 or 2 of those if necessary. And then the rejuvenation at the end to kind of resupport the person at the end. So it's a process, and that's why they want 1 month or 3 weeks. They like 3 weeks because they can do 1 week prep, 1 week panchakarma, and then 1 week recovery. So a lot of times the doctors, they're 3 weeks. If it's a serious condition, then they're going to or you're older and it's more deeply imbalanced, or there's more blockage, then they want 4 weeks. But there's 1 week prep, 2 weeks of treatment, 1 week recovery. So there's no such thing as panchakarma as just getting oil massages. It doesn't really exist. So that's why you're not going to have much success with treating many conditions with it. But true panchakarma, which really you can't do in the United States anyway, because you can't have leeches here, and and it's, unless you're a doctor, you can't really put things in people's rectum, and it could be some legal problems having people throw up doing this type. So we're very restricted here in what we can do. So what I'm doing is really more like home version, where I give you the herbs, you go home and do it. So you're on your own. I'm not doing it for you. I give you the enema bag, give you the herbs to put in it, the oils, how to mix it, and then you go home and you have to do it yourself. Same for these other treatments, vamana, vrchana. I give you the herbs, give you clear instructions, then you go home and do it. So I'm doing a type of panchakarma, but it's kind of like home version. And it's much slower because I have to explain everything to you and do it. In India, you don't have to worry. You don't even have to, they'll just give you the food. They just tell you to roll over and you just relax, basically. And you'll run to the toilet all by yourself. Nobody's going to have to tell you. So it's much easier just have them caring for you, and it's much more therapeutic. You don't have to worry. You don't have to concentrate. You don't have to understand Ayurveda. You don't have to cook the herbs. You just have to go there and relax and let them take care of it, and let somebody decide, which of those different treatments you should do. So those are the areas, our main misconceptions of Ayurveda that I wanted to cover. Making sure that you understand your real prakrti and vikrti and don't think in terms of just body type. And understanding the full treatment process of Ayurveda, that it's adjusted to the individual constitution, or prakrti and vikrti, and there's no such thing as one thing for one cure. That's kind of an allopathic view. And to understand the importance of identifying the causes and not just looking for treatments for your symptoms, because that's a way some people just look at their problems, is trying to pacify the symptoms. But that's not Ayurveda. And there's no one herb, no one tea, no one formula that's going to be suitable for everybody. Just like I gave the example of coffee and dairy. It's be suitable for one person and could be poisonous for another person. And the last area I just covered was about panchakarma. So I hope that helped you have a better understanding of the sophisticated level of Ayurveda, and hopefully you're interested in attending more of these classes. I'll do them every Sunday around the same time. I guess we'll keep going with this live if it worked. And then hopefully you can learn how to heal yourself or become a practitioner and help deepen your understanding of Ayurveda. And it's my pleasure to do so. And I just like to say that I'm only sharing my limited knowledge of Ayurveda. It's a very vast and huge subject, and I'll be studying it to the day that I die. And it has that type of depth to it. So I can only share to the knowledge that I have, to the experience that I have. And you should always have other teachers and other people to help to complement your learning, and not go only by what I say or what any one person says, because everybody has a different approach and understanding. But what's important is to have the fundamentals of Ayurveda understood. I didn't really cover the anatomy much of Ayurveda, but these courses that I'm doing will cover it. But quickly, Ayurveda doesn't look at things from let's say a limited point of view or microscopic point of view. They look at the body and for functional. So, for example, the circulatory system includes the liver and the spleen, which makes the blood, the liver, which is filtering and managing many aspects of the blood, and then the whole circulation. That's all one system to Ayurveda, because their view of anatomy is based on the functions. So kidney, bladder, urinary tract, it's like one system. And then they have different tissues in the body: fat tissue, bone tissue, nerve tissue, and these are all looked at in a different view. So, a lot of times in the West we're just looking at, our cholesterol is too high, but in Ayurveda, they're not able to look at your blood and determine whether it's triglycerides or cholesterol. They just know that you have too much fat in the blood. It's too thick. You got too much fat in there. You could call it whatever you want, but it ain't moving good. It's getting thick, and it needs to be improved. And then, of course, what is the cause? Could be your diet, could be your liver. So, it has to go a little deeper than just take a pill or take an herb to lower down that cholesterol. Often that's just the indicator. So often I find people are just trying to reduce down the indicator, the cholesterol, the uric acid, the creatine levels. They just want those numbers down. But what you really want is the systems and the organs to be working properly again. And that's what